Good day everyone, this is Johann and welcome to my second cycle audio videos in clinical microscopy. The first thing you should do after donning is to disinfect the working area. It is important to note that male patients for semen analysis should abstain 2 to 5 days prior to testing. For semen analysis, the first thing you should do after receiving the sample is to check if it is labeled with a date and time of collection. If not, you have to reject the sample. Then, record the time collected, time liquefied, and liquefaction time. Then, check for the physical appearance of the semen, such as its color, its appearance, viscosity, volume, and the pH of the semen. Up next is the microscopic examination of the semen. First is the sperm motility. For sperm motility, add 1 drop of semen into a clean glass slide, cover it with a clean cover slip, and view under microscope using high-power objective. In reading sperm motility, you have to read 20 high-power fields, and the grading are as follows. Grade 4, fast and forward progression where sperm move in a straight direction. Grade 3, sperm move forward but at a slower speed or in a curved direction. Grade 2, sperm move slowly and in a poorly defined direction. Grade 1, sperm move but fail to progress forward. And lastly, grade 0 means no movement at all. So this is an example of the sperm under the microscope for motility. Next is to prepare a smear for sperm vitality and sperm morphology. In a clean glass slide, add 1 drop of semen and 1 drop of eosin stain. Mix and let it stand for 2 minutes before smearing. In eosin staining procedure, the negrisin increases the contrast between the background and the sperm heads, making the sperm easier to visualize, while the eosin stains only the dead sperm, turning them into a dark pink, whereas live sperm appears white. The staining technique must be performed immediately after motility is assessed using sperm from the same semen sample. After 2 minutes, make a smear and let it air dry before viewing under the microscope. Once dry, view it under the microscope using the immersion oil and OIO. Assessment of sperm vitality is an important component of semen analysis. It helps to distinguish spermatozoa that are alive and immotile from those that are dead. Then, use the same slide to assess the sperm morphology. Sperm morphology refers to the shape, structure, and size of sperm. When you get a semen analysis, sperm morphology is an important fertility factor analyzed. During this assessment, the sperm is examined under a microscope to determine the ratio of normal to abnormal sperm. Next would be sperm concentration. Before starting, make sure that the pipette is clean and has no liquid inside. Then, pipette a sample up to 0.5 mark. After doing so, add distilled water up to 11 mark to immobilize the sperm. Then, mix it for 2 minutes with the use of pipette shaker, or you can shake it manually by hand. After 2 minutes of mixing, discard the first 3 drops of sample and then place a clean cover slip in the Neubauer chamber. Always make sure that the cover glass should always be handled by its edges. Then, place the pipette tip close to the cover glass edge, right at the center of the Neubauer chamber. Then slowly drop the sample and watch how the liquid enters the chamber uniformly, being absorbed by capillarity. In case the appearance of bubbles or the glass cover has moved, repeat the operation. Then view it under the microscope. For the calculation, if you use 2 WBC square, the factor is 100,000. If you use 5 RBC squares, the factor is 1 million. For example, you use the 2 WBC square, so 136 multiplied by 100,000 is equal to 13,600,000 sperms per ml. Lastly, for sperm count, you just have to use the formula of sperm concentration multiplied by volume using the unit of sperms per ejaculation. Do not forget to record the results. Do not forget to dispose all the contaminated materials to their proper waste containers. After the disposal, you must disinfect the working area. Lastly, you must perform hand washing after all the procedures and after doffing of PPE. And that's it! This has been Johann, and thank you for watching!